applying transdermal patch, first you need to gather the equipment, check the medication order against the original physician's order according to agency policy, clarify any inconsistencies, and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered, and consider the appropriateness of the medication for the patient, perform hand hygiene, and prepare the medication for one patient at a time. Read the medication and administration record and select the proper medication from patient's medication drawer or unit stock. Compare the label with the medication administration record and check the expiration dates and perform calculations if necessary. When all medication for one have been prepared, recheck the label with the medication administration record before taking them to the patient and return the medication stock patient's drawer. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medications at the correct time. Identify the patient. Usually, the patient should be identified using the two methods. Compare information with the medication administration record. Good afternoon, ma'am. I am Jonaline Boligon, your nurse for today. What is your name, ma'am?
Catherine Bernardo, ma'am.
Check the name of the patient's identification band, and if the patient cannot identify him or herself, verify the patient's identification to significant others. Complete necessary assessment before administering medications, and check the allergy bracelet or ask the patient about allergies. Ma'am, do you have any allergies, ma'am?
Nothing, ma'am.
And explain the purpose and action of each medication to the patient, and perform hand hygiene and put on the gloves. Assess the patient's skin where the patch is to be placed, looking for any signs of irritation or breakdown, and site should be clean, dry, free of hair. Rotate the application sites as per doctor's order. Remove any old transdermal patches from the patient's skin. Cut into half or fold the old patch in half with adhesive sides sticking together, and discard according to hospital policy. Gently wash the area where the old patch was with soap and water, and ensure the glove hand is thoroughly dry before holding the new patch. Remove the patch form from its protective covering. Write your initials and the date and time of administration on the label side of the patch. Remove the covering on the patch without touching the medication surface and apply to the patient skin. Use the palm of your hand to press firmly for about 10 seconds and do not massage. Remove gloves and perform hand hygiene. Evaluate patient's response to the medication with appropriate time frame, and document the procedure in the patient's chart.